I'm going to be talking to Josh Bergman, who was with the United Nurses of Alberta, about aerosol versus droplet transmission of COVID-19. Now, this may seem like a fine point to many people who aren't involved in the debate, but it's a big deal within the Alberta healthcare system and other provinces as well, because it has a lot to do with how healthcare workers, whether they catch COVID-19 on the job or not. So welcome to the interview, Josh.
Thanks so much for having me.
Look, let's start with the basics. What's the difference between aerosol transmission and then the way that we used to think about contracting COVID-19, which was through droplets, these bigger droplets that we respire and then drop to the ground, 6 feet from us, and then of course touches it. But thinking has changed on that, I understand.
Yeah, so aerosol transmission is essentially another term for airborne transmission. And essentially this means the inhalation of small respiratory droplets or particles that are often referred to as aerosols that contain infectious material and linger in the air for a period of time. Aerosols can be generated through a variety of activities, such as things as simple as breathing, just talking, shouting, singing, coughing, sneezing, and through certain medical procedures that are commonly referred to as aerosol generating medical procedures. So that's aerosol transmission or airborne transmission. Droplet transmission is the exhalation of larger droplets that fall to the ground quite quickly because they weigh more. They're larger relative to aerosols, but still relatively small. And the idea here is someone coughs or sneezes, they expel a larger droplet, and that lands directly on someone who's in close proximity. So onto their mucous membranes in their mouth, on their nose, or in their eyes, and that's how transmission would occur. The last transmission mode that's commonly referred to is contact transmission, and that's when your hands become soiled with infectious material through shaking someone's hand who just coughed or sneezed on their hand, by someone who touched a surface and that was maybe coughed or sneezed on, and then they touch their mouth, or maybe someone coughs or sneezes directly on their hands and then they touch their mouth. At the start of the pandemic, there was a lot of emphasis placed on contact and droplet transmission. Despite there being significant uncertainty around the modes of transmission at that time, because we were, barely into a pandemic, this pathogen had just emerged. There wasn't tons of research on the modes of transmission, but that's where the emphasis was placed. Over the last 18 months, there's been an increasing recognition of aerosol transmission. So leading public health and disease control institutions have moved to recognize the role of aerosol transmission. Despite this recognition, healthcare employers are still not placing emphasis on this mode.
Right, and the importance here is that, we've been told from the beginning of the transmission, stay 6 feet apart, which is great. That makes perfect sense if the primary means of infection is droplets. But if it's aerosols, they stay in the air for, could be potentially hours, particularly in a poorly vented indoor space. And that makes all the difference in the world in terms of risk assessment. Have I got that right?
Yeah, I mean, and it's this recognition and acknowledgement of the role of aerosol transmission that guides, or should guide, the development of infection prevention and control guidance, and should guide the decisions of healthcare workers who are making decisions around personal protective equipment that they're going to wear that will keep themselves safe. So if you're not recognizing aerosol transmission, you're not going to be choosing a form of respiratory protection such as an N95 mask.
Right. Now, why have Alberta Health and Alberta Health Services been slow to acknowledge aerosol transmission?
That's a good question. And I may not have all the answers, but based on my opinion, and I don't want to get too into the weeds here, but I think it's first partially related to how airborne transmission has traditionally been defined in the infection prevention and control domain, or by experts in that area. So airborne transmission has traditionally been defined as the transmission of these small respiratory particles over longer distances. And based on that traditional definition, experts have argued, well, if COVID-19 isn't typically transmitting over longer distances, we don't consider it airborne. The problem with that is that definition doesn't contemplate the transmission of these aerosols or smaller particles over shorter distances, which is believed to be the predominant mode of transmission for COVID-19. I think beyond that, I think there's been a reluctance to acknowledge this, frankly, because of egos, because of siloed decision-making, because of a failure to consider and engage with subject matter experts, such as aerosol scientists and occupational health and safety specialists, and a failure to practice the precautionary principle in the absence of scientific certainty.
So what we've got here, it seems to me, I'm looking at this as somebody from the outside, is that you've got sort of bureaucratic inertia. This is the way we've always done it. This is the way we've always looked at it, coming up against new science, and people's attitudes are slow to change, and which is not the best strategy, perhaps, in a dangerous pandemic like we're facing now. So look, if you look at it from an aerosol point of view, how does that change the way nurses do their job?
Well, it's significant because currently, based on how PPE guidance is currently structured here in Alberta, there's an agreement in place between healthcare unions, so United Nurses of Alberta and two other major healthcare unions, and healthcare employers in Alberta, Alberta Health Services and Covenant Health, that guides PPE guidance for healthcare worker, that outlines the guidance for healthcare workers. And one of the primary takeaways from that statement or that agreement is that healthcare workers have the ability to choose the PPE they feel they need for the situation in front of them based on their risk assessment. So they can choose to wear an N95, but the problem is if their healthcare employer is telling them, well, the N95 isn't needed unless you're performing this aerosol generating medical procedure, most healthcare workers are not going to stick their neck out and choose an N95 in situations that their employer is telling them they don't need to. So, it's important that employers are giving their employees the information they need to assess the given risks in the situations that they're encountering in their workplaces.
So to explain how N95s masks work better than, say, a surgical mask.
So there's two primary reasons why they work better. The first is filtration. An N95 mask is built with materials that does a better job of filtering out smaller particles or the aerosols that transmit through aerosol transmission. And the second primary reason is fit. Healthcare workers are fit tested for a specific model of N95 that fits their face. And this creates a tight seal around their face between the mask and their face that prevents the inhalation of those smaller or finer respiratory particles versus a looser fitting surgical mask that often has gaps around the side where air can enter and exit. The N95 provides a better fit on the face. So those are the two primary reasons.
Now, we've been hearing for months now, Josh, about, nurses are burnt out, some are leaving the profession. They're really concerned about unsafe working conditions, and some are, not surprisingly, being infected with COVID-19. How serious an issue is this for nurses, especially in Alberta, given the surge? We were up, last week over 2,000 infections per day. Things are really bad in the hospitals. We're talking about the hospital system collapsing in Alberta. What role does this issue of aerosol transmission, proper PPE, play in all of that?
Well, it's huge because, we have significant workforce capacity challenges right now in our healthcare system. So healthcare employers should be taking every measure they can to ensure the safety of the workforce, to ensure that healthcare workers aren't being infected with COVID-19. I think secondly, this is a Delta-driven fourth wave. So Delta variant is more transmissible than the other variants and the traditional type of COVID. So that's another consideration that this is the time now to be offering respiratory protection for healthcare workers to ensure that they're safe. This is just another layer of protection we can offer healthcare workers to ensure their safety.
Josh, thank you very much for this. Really appreciate your insights.
No problem. Thanks so much.